Sunday morning. I'm Jaden Jefferson, and welcome to Community Focus. This morning, I'm joined by ProMedica CEO Randy Oostra to talk about ProMedica's involvement as the title sponsor for the upcoming 2027 U.S. Women's Open.
Great to be with you.
So can you first give me an idea of what ProMedica's involvement in this Open will be?
Yeah, it's interesting. This actually started several years ago in some discussions that we had with the LPGA at the time. And I think it was their appreciation of some of the work we were doing in the social determinants of health, and this idea that they were very, very interested in not only elevating the game of golf for women, but a lot about elevating women and a lot about looking at those sort of issues in people's lives. So, we had a lot of discussions about things we could do not only in Toledo and in Ohio, but things that we could do on a national basis. Then it just so happened that the team we were talking to at the LPGA moved to the USGA. So it kind of precipitated a whole series of discussions about us being a title sponsor. And there's specific reasons for that, which they've never done before. And then ProMedica becoming the charity of the U.S. Women's Open. So we'll be involved with them for the next 7 years. The U.S. Women's Open will be powered and presented by ProMedica. And then we will also be their U.S. charity. And we'll also be doing some work with them at Men's Opens as well. And then simultaneous to that, they've announced a couple of golf tournaments in Toledo at Inverness. So even though a lot of people try to connect the dots between those, they were somewhat separate discussions. But it's a real positive. I think it's positive for both ProMedica. It's positive for our community. It's a positive for Inverness. And I really think it's positive for kind of just their reflection on how these issues are important in people's lives and women's lives.
A lot of people have made that connection and, have saw the benefits of the Solheim Cup that happened right here in the Glass City. So what do you think could be the benefits of ProMedica being involved with the U.S. Women's Open that's also going to be happening at Inverness Club here in Toledo?
Yeah, the Solheim Cup, a lot of times people say it's all about golf. It's not about golf. It really reflects a lot of things. Yes, we're thinking about golf, but in the case of all these, and the Solheim Cup, it was a major source of pride for our community. It was a great rallying point for our community. I think when you couldn't help but talk to people and say, we want to get XYZ done by the Solheim Cup. It's great from an economic development standpoint and, jobs and businesses and the economic development creates. I also think reputation matters, and I don't think people always appreciate that. But, I think, you talk to a lot of people who from around the country got notes from people saying, wow, doesn't your city and, the community look great? You guys have really quite, put on a really great event. And then I think it's just a lot to, I think it should be a real source of pride, the way all of the whole region came out, and really from a volunteer spirit to the things that were done, not only in Toledo, but the entire region. And so I really think it speaks volumes to, how positive it is for a community. And it's really positive on a lot of different fronts.
Talked about this earlier in the interview about some of the reasons you believe that ProMedica was selected to be the presenting sponsor. So give me an idea of some of the things ProMedica has done over the last year that have really, helped our community.
Yeah, this, I think it was interesting when we started talking more about the Solheim Cup, and we did something called the Drive-On Championship, which was one of the first events that, was coming out of COVID that women's golf had. I think it was the first event. And it really allowed us to talk a lot about a lot of different things. We talked a lot about COVID. We talked about coming out of COVID, what that would look like, the impact on people. And then just this ability to talk about health and well-being in a broader sense. Yes, we take care of people when they walk into facilities, but I think the realization here is that our health and well-being is much more complex than that. It has a lot to do with, where you're born, the community you're born into, whether or not, you have the ability to navigate life, the social determinants of health that we talk a lot. Those sort of issues have a lot more, emphasis in life. And we've seen that especially in the events of the world and how we look at inequities and those sort of things. And, from the USGA perspective, they wanted to be part of that. And so it's allowed us to talk with them, their staff, and their other sponsors about how we can, create more attention to the issue. how we can get more people involved. So I think just from a community standpoint, it celebrates kind of our national role in social determinants. It celebrates the work that we've done, the work that we're working on. Of course, we're, got a long ways to go and addressing a lot of needs in our community. But I think the other idea here is just, can we take our lessons learned and help others? And that's really a lot which we've seen so far. And we're working in a lot of different communities, across the United States, partly because that's our footprint when you look at the work that we do nationally.
You talked a little bit about the COVID-19 pandemic and the impact that's had. It's put a lot of healthcare systems, hospital systems, they were strained because of this pandemic. So what was that impact on ProMedica in particular?
Yeah, this has been a difficult 2 years for us all. I think when you think about where we were a couple of years ago and hearing about this COVID thing, and then what's happened over, 2 years of our lives. And so, it's for those of us that have been doing this for decades, it's clearly the most intense, healthcare event we've ever had in our lives. And just because of all the uncertainty that we originally, found with COVID, immediately we had issues relative to testing, who had COVID. We had supply chain issues. We were all working from home, but our healthcare workers weren't. And so they were there 24/7. We always say 24/7, 365, they don't go home. And then it's just been the intensity of taking care of very, very sick people for over 2 years. And, I think what's happened is, instead of having families there at the bedside, our caregivers were there. And we talk a lot about just the fatigue that, they face, not, only physical, but the mental fatigue, the concerns about, am I going to get COVID because of my job? Am I going to, expose people to COVID? And then being at people's bedside when they were very, very sick, and for some, their last minutes, that the caregivers were there because their families weren't allowed to be there. And so I think you think about that for a little bit. I think you can think about the intensity that puts on a person, and then the fact that it's gone on and on for 2 years. So, it's kind of ebbed and flowed as far as volumes are concerned. Right now, we seem to be headed in a really, really good direction. A few months ago in ProMedica, we had, 500 plus patients a day at our highest with COVID. And, the last couple of weeks were, less than 50. And a lot of folks aren't near as sick, although we still see some sick. So I think we've seen a change. And so, but the impact on people, we talk a lot about workforce. It, of course, financially devastated a lot of, healthcare institutions. They weren't able to do a lot of testing. They had to close their, a lot of other things that were more elective in nature. We have a large senior footprint that was hit very, very hard as well. The long story short is we'll be fine, but it's been tough. It's been tough on about every front you could think of. We talk a lot about healthcare heroes, and they were a hero a year ago. They're still a hero, and what they've done for the last couple of years is truly something to be admired. And I hope people just stop, think about healthcare workers, say a prayer for them, because it's been a tough 2 years.
I hope that's something that people carry with them, even as we're coming out of this pandemic, is that they weren't just heroes when COVID struck. They were heroes all the days, weeks, months, years before then. So coming out of this pandemic, what is your perspective, your outlook on the ProMedica healthcare system and their work in our area?
Yeah, we always say, healthcare workers, they work 24/7, 365 days a year, every holiday, every weekend. And especially in hospitals and many times physician offices, take care of everybody who walks through their door. And in some cases, it's, a situation where it's, something you'd expect. And other times, our people get thrown into very difficult situations that even deal with their own, personal, safety and security as they're caring for people. And I think that's the thing here. These are truly people who are called, to a mission, have a strong, strong purpose. And I think, we do have some healthcare challenges today relative to staffing. We think that will start to, hopefully get back to some normalcy as we get moving along. And I think the other thing is that just this realization that healthcare is delivered in so many different venues. And when we think about our overall health and well-being, yes, when you see a doctor, when you go to a hospital, it's pretty clear. but it's those other things in life. It's these social issues. It's, safe neighborhoods. It's having a life purpose. It's, the effect of diversity, equity, inclusion on people's lives. Those are all the things that really make up total health and well-being. And so, we spend a lot of time, we do a lot of investments in the community relative to economic development, jobs, trying to create the kind of community that creates a vibrant economy. We think that's all connected to health and well-being. And so as we ask, people to think about the future, A, it's just, again, thanking our healthcare workers, and B, just this more realization that, healthcare is much more broad and global than maybe one thinks, and that, our system needs to change, and it will change. But again, I think it's going to be on a much broader basis.
Yes, and we're definitely seeing those changes across the industry. So definitely a good thing to see, of course, nationally and locally. ProMedica CEO Randy Oostra, thank you so much for your time.
Great. Good to be with you again.